Hello everyone, I am Dr. Rajakumar, consultant pulmonologist. How to differentiate which is severe breathlessness, which is mild, moderate. So we have two different types of classifications. Most commonly used for respiratory system is MMRC, Modified Medical Research Dyspnea Scale. And then next commonly used for the cardiac conditions is NYHA, New York Heart Association Dyspnea Scale. So based on that, we can grade the patient based on the patient's complaint, which class the patient is fitting into. So we ranging from the MMRC grade 0, MMRC grade 4 we have. So based on the patient complaints, based on the clinical conditions, so we can differentiate all the patients into a particular group of conditions. Then we have two conditions. Few people will have breathlessness from quite long time. Few people will, all of a sudden the breathlessness will start overnight. So how we will differentiate? So there are two conditions. One is acute causes of breathlessness, another comes to the chronic causes of breathlessness. So first we will go into the acute causes of breathlessness. So acute causes of breathlessness, if we focus mainly onto the respiratory conditions, first comes bronchial asthma. So bronchial asthma, as all of us are aware of, what will happen in bronchial asthma? Our airways will get narrowed, so the air won't be able to go inside our lungs, so we will feel shortness of breath. So that will be triggered acutely. So it must be because of the cold exposure or because of some allergic reaction. That will be an acute condition. Second comes, especially in pediatric age group, what we will see is foreign body aspiration. If the kid is playing with the toys, or if suddenly some if something he suddenly aspirates, some coins or something, because most commonly we will see it in the kids. So if they aspirate that foreign body, if it goes into our airway, so there will be sudden onset of breathlessness, which we can say is choking also. Then comes another causes, as I've told, there are few other conditions, especially in COPD. What will happen? The pleural space could be filled with air. So that condition we call it as pneumothorax, which we commonly see in COPD patients. So because all these events are happening in sudden, so this is the condition which usually give us an acute onset of breathlessness. Then comes to the cardiac conditions, as we have talked about. Any patient with severe LV dysfunction, so if there is fluid accumulation and there is a condition called as pulmonary edema, which usually develops because of the heart failure, it could be left heart failure or it could be right heart failure. So these are the conditions where the breathlessness will be aggravated over a short period of time. So these are the conditions for acute causes of breathlessness. Then we will go into the chronic causes of breathlessness. So chronic causes of breathlessness, as we have told, most commonly seen condition for the chronic causes of breathlessness comes to the COPD, chronic obstructive pulmonary disease. So those are the patients, usually they will have some amount of vague discomfort which is there throughout the life from the time they have been diagnosed. So as I've initially told, grading we can do from 0 to the 4. So they will be having always 0 to 1 grade of breathlessness, and few other conditions when they have pneumonia, when they have other infections, multiple other conditions can aggravate their breathlessness over a period of time. So from grade 1 they can reach grade 3, they can reach grade 4. So these are the conditions where they have chronic symptom of dyspnea or breathlessness. And then comes to, which means the pleural cavity is filled by the pleural fluid. So the pleural fluid, it won't usually happen overnight. So it will be gradually filling. So the breathlessness will be initially started with 0. Over a period of time, based on the frequency, based on the conditions which are causing the pleural effusion, patient can develop severe grade of breathlessness, which is MMRC grade 4 breathlessness, over a week of time or maybe in 10 to 15 days. So this is one more cause which can lead to chronic causes of breathlessness. And then comes to kidney failure, comes to liver failure. These are the conditions usually we will see with chronic conditions for breathlessness, because there is a organ failure. So they usually tend to go into severe grade of breathlessness with the treatment, goes back to the never normal, MMRC grade 0 or grade 1. Then over a period of time the fluid will again reaccumulate, again they will reach to MMRC grade 3, grade 4. So these are the most common causes for acute causes of breathlessness and then chronic causes of breathlessness. So now coming into the diagnosis. So anybody who is having breathlessness, which usually patients with grade 2 to 3 tend to seek medical attention. So those people, how we will go about, how to diagnose. So majorly based on the clinical symptoms, so that the doctor can evaluate which organ is involved. As I've told in the beginning, we can have conditions related to the lungs, heart, and then comes to the kidney, and then comes to the liver as well. So how we will diagnose? So any condition related to the lungs, we are going to diagnose by a chest X-ray and PFT. If the condition is related to the heart, so we need to do an ECG and then we have a 2D echo. And if the condition is related to the kidney, so we are going to do an ultrasound abdomen and then renal function test. And then if you are suspecting condition is related to the liver, again we can do liver function test along with ultrasound abdomen. So this is broadly, all these things is decided by the doctor based on your clinical history. Okay, so it is always advisable if you are suffering with shortness of breath or if you are experiencing dyspnea and doing your day-to regular activities from quite long, it is always advisable to consult your doctor and seek proper diagnosis before it becomes too late to be treated. Thank you and see you in the next video.